There's a danger in the drugs themselves. Do you know this mere Panadol that we keep taking is dangerous to the liver if you take in excess?
Panadol?
Yes. So many people ask like that, oh, you mean Panadol can hurt my liver? Yes, Panadol hurts the liver if taken in excess. And Brufen hurts the stomach. The Maasai who used to take a lot of meat kitambo, ama mafuta, they used to eat mafuta.
Yeah, and blood.
And blood, raw. In the olden days, the same Maasai used to walk
the whole
day. You know, and the patients agreed, hey, by the way, that is true. Because I work in the office, I sit in the office for 10 hours. So there's no way
natoka naingia gari.
Yeah, naingia gari,
naingia kwa nyumba kwa TV.
Yes, because his problem was also back issues.
Yeah.
So I was like, yes, Rafiki yangu, your lifestyle, if you're to adopt the older lifestyles completely as a package, then we would allow you to take as much meat as you want and as much fat as you want. So if people knew that that was possible to be treated, mental health is also as important as physical.
And Happy New Year. This is Lucy Mori of Lucy Mori Network. Again, we are here in the new year. So happy to see all of you. And today we are bringing new stuff. And we have a medical doctor to talk about the issues affecting our elderly. And this medical doctor, she is Dr.Joanne Medina of Aragon Healthcare. And she is the founder of Scrubs Kenya. Ukitaka uniform, zile smart, zile mnaonanga kwa TV, zile zina watu wanavaa kule kwa wazungu, Marekani, UK, you go to Joanne Scrubs. She founded that. She is also a gospel singer. It's good to have you today, Joanne.
Asante sana.
Good morning.
Morning.
Happy New Year.
Happy New Year.
You look happy already.
I am.
Okay. Welcome to Lucy Mori Network.
Thank you.
Thank you for coming. And we are happy to have you today talk to our viewers about the issues, medical issues affecting the elderly that a lot of people don't know, or they know and they don't know how to go about it. There are some that may need medical attention, others they need home remedies. But so our viewers would like to hear from you, from the horse's mouth. You are a general physician, so you know everything.
Yes.
Karibu sana.
Asante sana.
Yes.
The advantage of being a general physician, that means a doctor who treats all the way from a child, had an elderly patient, pregnant women and men, is that you can see the progression of illnesses kutoka utotoni. And now, elderly people, most of the time, the things that affect them are to do with things that started when they were younger. And you see, most of the time, it will be lifestyle illnesses. And you can find somebody who is eating well. Rarely do people exercise in our country, by the way.
I like when you say the importance of being a general physician is because you walk along. I've always told my viewers that aging is a process.
Yes.
It is not, you know, when you hear age, they think it is when you are old. But it's a process. It starts from when you are little. And some of the things affecting them today, they could even have started affecting them long time.
True.
So I'm glad you're here.
Yes. And the thing about aging is that it's a thing you can influence. You can influence how you will be when you're older, how your health will be. At your age, a 13-year-old can influence how they'll be. A 17-year-old who is smoking right now will definitely have failing lungs by the time they are 42. Yeah, so usually when people think about issues that affect the elderly, young people do not want to listen to it, yet it is even important to them. Now, when I mention about lifestyle diseases, I mean illnesses like asthmas that come later, hypertension, diabetes, and in our country we have a lot of that. So by lifestyle tenor, not to mean that people are, it's not only their fault, also the foods that we are having nowadays, they're not processed, and they're processed and they're not as natural as they used to be kitambo. So we buy foods which have been imeongezwa chemicals for them to grow faster because people are looking to make more money. So in as much as you're eating healthy vegetables, unapata ilipandwa na chemicals fulani.
Are you talking about GMOs?
Yes.
Wow.
Yes. So obviously, if you look at the people up country, by the way, and you try and look at how many of them are obese, ni wachache sana. Yeah, and it's because especially people living in the cities are taking products ambazo ziko zingine ni GMO, zingine ziko chemically treated, versus the person who's up country mwenye anachukua directly from their own farm and they can see how it was planted. So the first thing, who are the things that we are eating? To the kinds of work that we have. Another most common thing that older people, and when we say elderly, I don't mean people in their 70s, inaanzia hata tukiwa 30s and 40s. Many people are having backaches, for instance. Na unapata it's because of the nature of work. People are having long hour jobs in banks, for instance, ama kusimama, sitting on their offices. So you find people will have issues affecting their hands, affecting their backs, affecting their legs. Yeah. So mtu atakaa akifikiria ni kawaida, labda lilala vibaya. Yet it is a thing when they come. We don't even give medicine for that. Yeah, we advise you on how to minimize your sitting hours. We advise you on how to do back exercises ukiwa nyumbani. Kwa sababu sahi ni tofauti with the past, where people would move around. You know, their jobs involved moving up and down. So nowadays we do a lot of sitting. Kutembea, kukua physically involved. Nowadays we do a lot of sitting in offices, which people, yes, are trying to make money, but we also we don't have time for exercise. Yeah. So that brings us down. So that is about back exercise and bone issues. Another thing that has become rampant is hypertension. Yeah, and most people think pressure is because of stress only. No, pressure can also come again because of diet. I mean, what you eat affects almost everything, because if you're eating things which are fatty foods, tikuzi tuko na KFC, we have Pizza Inn, yeah, and processed foods, all that goes around your arteries and forms a buildup of fats. So when your heart is trying to pump blood through those tight arteries and veins, unapata kuna pressure iko mingi and heart issues as well. Now, another problem that older people are having nowadays, and they don't want to accept, is that when a doctor tells you your pressure is high, we need to manage it, many people have denial. Unaona? So they'll say, it's high because nimetembea kwa stairs kabla nikuja hapa, or it's high kwa sababu juzi nimekasirika sana.
They start advising the doctor. Yes. Now.
So the problem with patients nowadays is Google and I don't know, some pride, because a doctor, you know, we go for training for many years and we see many patients and how they end up. So it's nowadays it's quite common to find a 30-year-old getting a heart attack, you know, or the other day I had a 22-year-old who is beginning to have a stroke because of pressure. And when a doctor advises you,
so pressure causes stroke?
Yes. Pressure, the major fears that we have with it. You see, when your arteries are under pressure, say for example in the head, and you have not controlled the pressure, if it bursts open and the skull cannot expand, inamaanisha that blood will collect there and push the brain to the side. That's how you describe a stroke. Yeah. And when it's happening to the heart, it means one side of the heart, you know, the heart is also fed with blood. Yeah. So if an artery feeding the blood has burst open or has been blocked by cholesterol, then that part of the heart will not work well. That is how you get a heart attack. So when a patient comes to you, labda mara nyingi they come for something different. Say they have a flu. Then you tell them, Andrew, I am focused more on your pressure. They will think, no, you just treat my flu, let me go home, I will exercise.
Because that is denial.
Yes. And you see, no doctor is happy to put you on medicines for pressure or for diabetes. So before we reach the level of needing medicines, we'll just advise you on exercising. But we need you first to accept ya kwamba this is a thing that you have and we can manage it. Yeah, so most of the time we advise on exercising. Even just 10 or 15 minutes in a day or a few days in a week goes a long way for somebody to control their pressure and their sugar versus somebody who does not. Yeah. So if many people had the attitude of listening to doctor, you can Google, yes, but you listen to a doctor to give you guidance, we would have very few issues with the elderly.
So what happens a lot of times, like even just recently, you hear someone slept, tulikuwa na yeye jana, alilala, akuamuka.
Hakuamka.
Tuliona matapiko next to him.
Yes.
What is that?
Now, first of all, ukisema matapiko, that is quite typical of a stroke. Because when somebody vomits, it can be a stomach issue, it can be a bladder issue, it can be a brain issue. So whenever you're having something that afflicts the brain, you vomit kwanza mbali na wewe. Unaona? So that is a sign of high pressure inside the brain. And somebody who slept...
Pressure inside the brain?
Yes. So
and
you
then
see, you have arteries everywhere. So if the arteries inside the brain or the veins are having high pressure and they burst open, you will vomit, itaruka mbali. Yeah, so you'll find vomit next to the person, but sometimes you may not. And then two, it can give you weakness on one side. But if somebody slept and did not wake up, highly likely they had a stroke in their sleep.
And here now today you hear no, lazima alirogwa, alipewa poison, bibi alimuua, mabwana amemuua. So
misinformation ni mingi sana. If you do a postmortem on those people, you'll find an answer. You'll find an answer, yeah. So, and most of the time, let me tell you, the main thing ailing our country is denial. Denial
is another disease.
Actually, that is another, to it a pandemic or something.
Yeah.
Yes, because, and this is the thing that we ask patients first when we find them to have high pressure or high sugar or illnesses which are long-term. We ask them, in your family, do you have anybody with pressure?
Historic.
Yes, and the first person will say, in our family, there's no history. And it's okay to say so. But remember, if you came to hospital today and I found you with high pressure, you will not leave the office and call everybody and tell them I have been found with pressure. So that means there could be people or cousins in your family that have pressure that have never told you, you know, because you talk about other things. And another factor, the older people, our great-grandparents, they never used to have access to healthcare. So they could have had diabetes and never known. Yeah? So when a doctor is guiding you, kuwa too humble. Ama kama you're doubting the doctor, you'd rather seek a second opinion. Yeah? So if a patient doubts what I advise them, they'd rather listen from another doctor. But you find the denial is so much that I could 4 doctors could see the same patient and advise on check your pressure, and they still would not want to.
So when so your history, when the doctor asks you about the history, has anyone been, maybe some they knew even their mother, their father died of diabetes, and still they don't say it. It is wrong.
Yes. So yes, you know when you come,
how can it help the doctor to?
Yes.
To help them.
One thing that helps doctors is honesty from the patients. If the patient can confess, you know, sometimes a patient will come and say, hakuna kwetu. By the 4th visit, they say, okay, kusema ukweli, my father died without us knowing, or I had him mentioning that he had pressure but alipona. Or I had my uncle had pressure but ilianza akiwa later. But it always starts later.
Uncle is a relative.
Yes. Or animali sana ni sister ya mama yangu. That's very close. That's very close. So honesty would help from patients, because our main aim as doctors is to try and help our patients.
So to the young people, if they realize that their parents have such things, that maybe your father, your family, some people have diabetes, others have pressure, others maybe they have had heart problems, what would they do? Usually when any patient comes to us, even when they are not sick, say they've just come, I've just come for a wellness check. We like that. Now on just to congratulate patients nowadays, they come also just to check. I just want you to check my whole body. People are beginning to embrace that. And when they come there, we ask about even cancers in families. Cancer. Yes, and we do screening. So if somebody has diabetes, for instance, in your family, there's a test that can test your average of your sugars for the past 3 months. So we can do that for you yearly. Ukae ukijua sina, nimepimwa na nimeambiwa sina. Ama unayo, umanage mapema. Yes, ama ninayo, and I am managing with my diet. There are people who have reversed diabetes, by the way. There are people who have they control their pressure without medicines. The more you don't control it early, the more it affects you later, and now you're stuck with medicines. For instance, in diabetes, if you can manage it with diet in your 30s, you'll avoid using injections in your 60s. You see, so somebody, I like your show, somebody who understands that things affecting the elderly can be managed from when they are young, then this is somebody who's helping themselves. Yes. So it's not even just about the elderly. So these major diseases, and usually they are commonly with the elderly, and probably they did not start then. They
Yes.
start earlier. There's a diabetes I hear there is type 1 and 2.
Yes,
What are
yes.
these types?
You find type 1 is it starts in childhood. So that means diabetes means your body is not able to take sugar from the blood and put it into where it should be, the muscles and elsewhere. So you have too much blood in your sugar. Yeah. Now type 1 means the particle or the insulin. The insulin that's supposed to do that job is not there. The body is not producing it. So that person has to be on injections for insulin for life. So this one will know when they are young, and this one you'll find it's not their lifestyle issue really. Alizaliwa hivo. Either it's in their family or their pancreas that makes the insulin does not work. Type 2 is when you have insulin, the one that helps with sugar management in your body, but it is not enough. So your body needs, say, either medication to help it, or you have insulin but it's not functioning well because either you're overweight. Yeah. So when you're overweight, it decreases.
So you mean overweight could be a cause of type 2?
Yes.
Because your insulin could be okay. So
it's
as you gain weight.
Yes, but as you gain weight, it decreases your sensitivity to that insulin. That's enough. So once you reduce weight and you embrace healthy lifestyles, then your insulin will be sensitive to doing its job. So you have reversed the diabetes.
When you say health lifestyle, what do you mean?
Healthy lifestyle is what you're eating and the physical activity that you're doing. Yeah. So even if it's just brisk walking around, unaona, that's a healthy lifestyle compared to sitting for long hours. By long hours, I mean 2 hours and more. Yeah. Healthy lifestyle means the foods that you're eating. Nowadays, almost all foods ni carbohydrates mingi. Yeah. By carbohydrates, I mean mostly foods which have been made by flour, wheat. You see, so we have, by healthy lifestyle, what we advise most people, whether you have diabetes or not, if your plate could have more vegetables and proteins, especially white meats, and less of the carbohydrates. You know, in our country, we are used to a big plate of ugali and a little of the veggies. If you could reverse that, you would even see a change in the number of diabetics we have in our country.
Sometimes I hear people say, the doctor told me nisikule nyama. Nitakula kwa sababu Masai wanakula nyama kila siku. Mbona hatujaisikia Masai moja amepatwa na stroke ama hata
I like that you've brought that up.
Yeah.
The other day I had a Masai patient who had high pressure kabisa. The sugars are very uncontrolled, and now too much meat. This patient had arthritis ambayo inaletwa na nyama, because we have different types of arthritis.
Do you inaitwa gout?
Gout, yes. So this patient had gout, and I was advising not to stop, to minimize on the meat the person is taking. And his argument was exactly what you said. It used to be done in the older days. So I sat with this patient because I could see from the documentation of other doctors, that's always his argument. So I gave him time with me, and I told him now to answer me. The Maasai who used to take a lot of meat kitambo, ama mafuta, they used to eat mafuta and blood raw in the olden days. The same Maasai used to walk the whole day. You know, and the patient agreed, by the way, that is true, because I work in the office, I sit in the office for 10 hours, so there's no way
natoka naingia gari naingia kwa nyumba kwa TV.
Yes, because his problem was also back issues. So I was like, yes, rafiki yangu, your lifestyle, if you're to adopt the older lifestyles completely as a package, then we would allow you to take as much meat as you want and as much fat as you want. But now that our lives have changed, how we look for money nowadays and how we look for a livelihood is different from how it was kitambo. So yes, you could have cultural things, even the Kalenjins, the Mursik, it's okay. But you see, nothing in medicine should be done in excess. Yeah. Even oxygen should not be breathed in 100%. Ikona effect zake. So you find even the person that's taking too much milk has a lot of calcium, which is good for bones, but too much calcium in the body will take your iron down, so you will get anemia. So yes, so if they're taking a lot of milk, let them balance with meat. You see, but nowadays, if you're saying kama ile wakati wa COVID, now everybody started taking lemon water, hadi lemon zikaisha in the market, because I'm trying to take vitamin C. But now too much of the vitamin C, another thing that's too much also in people nowadays is acidity and ulcers. And ulcers. And when you don't have it treated, or when you're having too much infection. Now remember, the acidity is happening And our water is also contaminated. So we have germs. There's a common germ inaitwa H. pylori.
Yeah.
That one digs ulcers in your stomach. Now, if you go without treating ulcers for long,
Actually, what causes ulcers?
Ulcers have several causes, and most of the time it is too much acid in your stomach, which creates a very good ground for the germ to multiply. The most common drug to cause it is the H. pylori I mentioned. And stress also.
So germs thrive better in acidity.
The specific germ I've mentioned, H. pylori.
H. pylori.
Yes, it loves the acid in the stomach. It will form more acid. It will corrode your stomach wall as well. Yeah, so that will cause ulcers for you. Now you find patients will come, H. pylori test is, for instance, 2,500.
Ile unanunuanga dawa ya 7,000.
Yes,
Watu
you
wanaijua
know.
hivyo.
Wanaijua. Sasa unapata mgonjwa akija na kuna shida ya tumbo, anashangaa tumbo inaniuma tu kidogo, mbona unanifanyia test ya 2,500? Why are you giving me medicines worth 7,500? Thinking that we are out to look for their money. So they will refuse the treatment, they'll refuse the test. Yeah, because the other stool test is like 500 shillings. So they will not understand why we are doing this test. Yet nowadays we see it even in children who are 6 years, for instance. Yeah, so if you go with untreated H. pylori, you know, we have lost close people even at our workplace because of cancer that resulted from untreated ulcers. You see? So when I told you denial and too much know-it-all amongst patients is a thing that is causing people to go into more illnesses. Whenever you doubt a doctor's advice, listen to a second doctor about it. They might even differ on their treatment. Listen to a third and decide. But if Google is your go-to, I can today wake up and start writing about engineering and I'm not an engineer. Utapata mtu ataamini hiyo. So there are people who write about medicine and they've not had background training.
So, Daktari, are there dangers of taking painkillers? Because a lot of people, maybe medically, you tell us if there are other underlying things could be just beyond the headache.
Yes.
You find people that have been having this headache, nimekunywa aspirin, nimekunywa Panadol, nimekunywa headaches, all those are maybe they have some paracetamol inside.
Yes.
They are just taking almost the same thing.
Yes.
Unaka. Ni kichwa ilimuua. Is there any danger?
Of course, definitely. First of all, there's a danger in the drugs themselves. Do you know this mere Panadol that we keep taking is dangerous to the liver if you take in excess?
Panadol?
Yes. So many people ask like that, oh, you mean Panadol can hurt my liver? Yes, Panadol hurts the liver if taken in excess. And Brufen hurts the stomach. Yeah, that's what I was saying. In medicine, don't do anything in excess. If you're having a persistent headache, anytime you have a symptom in your body, it's your body trying to alert you to take caution about something. So if you're having a headache, you can't just say, maybe ni kwa sababu nilala few hours, or maybe because I have stress. Mina kuanga tu na headaches. So you can find somebody.
Denial again.
Yes. So somebody comes to hospital, will tell them, because of this headache that you're having, we need to do a scan of your head, for instance. Now, the first thing happened to me the other day. I treated a patient, very young guy who had symptoms of a stroke. And I told him, this is an emergency, we need to do a scan. So they found a way to escape the hospital, went elsewhere, took medicine, and that was it. And now we usually follow up to find out what happens. So you find a few patients that denied, either ended up with a stroke. So they come back limping and they say, I should have listened when you told me to do the scan. Had I done the scan, we'd have done the surgery earlier. We went and found I have a growth, sehemu fulani. Yeah. And I also understand our patients that healthcare is not cheap. Yeah. A scan alone, for instance, of an MRI of the head, you can find can cost 18,000 to even more than 3,000. If it is a CT scan, could be around 6,500 or 5,000. So you could find somebody does not have that money or has that money in their insurance, but they cover CO mingi. So they're like, I'll just go on with my painkillers. I'll do the scan when it gets worse.
So as we wind up, because of time, Daktari, to our viewers, if you have not subscribed yet to Lucy Moria Network, we are bringing up so many education and inspirational stories. These are not stories. The doctor is here to train and let us know the right thing. Please subscribe. Do not forget to subscribe so that you get the alerts as soon as we upload new videos. Daktari, as we wind up, because this is we'll have to make a part 2 continuation. You have to
Yes.
continue because this is a wide range.
Very wide, yes.
And actually, we really thank you for highlighting these things. I think we have to take disease by one. And with this, I would like you now to tell us, a lot of people, like, they make a lot of money, they have retired, they have built their homes, but they end up with a lot of depression. You think someone is just retired, they have everything they need.
True.
Because for our society, everything is money.
Yes.
That's what they think.
Yes.
So why would you be depressed?
Na uko na
Na
kila
uko na
kitu.
kila kitu. Umeretire, uko na gari in the village, uko na nyumba. What do you think could be the causes? Because I met a lot of elderly who are really depressed, but they are in denial.
Yes.
They don't think they are. They think they are okay. But if you look at them, they are not okay. What do you think could be causing this?
The things that cause depression mostly nowadays, first of all, is
people.
in the elderly, is lack of fulfillment. With, you know, you could have everything, but you're not fulfilled with it. You realize that you don't have...
There is everything and fulfillment?
Yes.
There's a difference?
Yes. So you have everything, but you're not fulfilled with it. Something is still missing. So you feel like either your family is not close with you, or you have an ailment that is always persistent with you, so you cannot enjoy. You know, you could afford everything, but you cannot eat sugar.
Yeah.
You know, so there's that. And then second, you find some people, mental issues. The thing that causes many people to have nowadays is that there's stigma. Ni vile it's coming down, and we thank God it's coming down. Somebody thinks that if they admit that they're having depression, it's a bad thing. But just to give our viewers hope, nowadays people are embracing counseling. Yeah. So the thing that is causing it to be too much is that people don't seek help early enough, because of, I will look like a weak man if I am a whole professor and I go for counseling. Yeah. So if people could go for counseling early, just get guidance, because treatment is not only medicine. For depression, stress, mental illnesses, we take you through what we call psychotherapy. We give you counseling sessions, you get better, you get fulfillment from what you're having. And if you're having health issues, we also guide you on how to have them treated. So depression most of the time is because of lack of fulfillment, and also lack of knowledge of the fact that this can be treated. So dementia, lack of information. We treat you, and most doctors will not judge you. If you come there and say, I have a temper, or I'm stressed about things, or I'm depressed about my workplace, about my marriage, about my children, you know, we get you to get counseling such that you can come back to a normal functioning individual. So if people knew that that was possible to be treated, mental health is also as important as physical health.
So thank you so much, Dr. There's another area, but that one we are going to do it extensively next time.
Okay.
There's a disease which is not very common here in Kenya. It is there, but it has different names.
Yes.
Alzheimer's.
Yes.
That is a degeneration of the brain.
Yes.
So a lot of people, they do not know they are sick.
Yes.
They do not know this is a disease. They do not know this is it's see wazimu, but people start saying ni wazimu. You start to say yes. You start to say, oh, nimeanza kusahau, ninaenda hata kwa nyumba yangu, I miss the gate, ninaenda hata kwa gari nikipaki ninasahau nilipaki wapi.
Yes.
So hiyo unaambiwa hiyo ni uzee.
Yes.
It's not.
It is not. Yes.
I guess it's a disease.
Yes.
And it is something that you can guide people. You can slow it if people start knowing the causes.
Yes, yes.
So next time, let's talk about Alzheimer's, which is so common. Also, we may talk more of this major depression and denial in our society. So we want to thank you so much for now. And thank you again. Let our people know. Let our people learn. Let our people understand that the medical issues, I mean, problems, it's not just about money.
Yes, true.
And viewers, we want to say thank you so much again for listening. Continue tuning on. Make sure you subscribe so you do not miss any of our inspiring, educative, and informative information. Thank you, Dr.
Asante sana.
Thank you so much.
Thank you. Okay.